So welcome everyone to our first ever Innovation Hub Coaches prep session for test box number 1. And so this, as you know, this session was delayed from the original time that we had it scheduled for. And so our apologies for that, but as you know, you're actually kind of behind the curtain for a large provincial initiative that's being developed, and sometimes it's messy behind the curtain as we're starting to figure out how this is going to unwind. And because this is the development phase, we are learning right along with you, and so we had some technical stuff we needed to sort out, and we weren't quite ready to give you the best experience for your coaches prep 2 weeks ago. So thank you for your patience with us as we sorted out our procedures and processes, and hopefully today will be a good experience for you. So I'm just going to. I think I can advance the slide. It's not.
Yeah, it's just at the top, Michelle.
Oh,
at the
there
very
we go.
top.
Okay, gotcha. Okay, there we go. Okay, thank you. Speaking of technical challenges, I was just demonstrating for you the effect of having a technical challenge and working through it. So if you have a challenge like that, please feel free to let us know, and someone like Jessica or Lisa, who are helping us with the technical stuff, will also give you some guidance behind the scenes just like that. So just a little reminder on your phone line, if you don't, the easiest thing to do if you're on your iPhone or something like that, just use the mute function on your actual phone. But if you don't have that, then use *6 to come on to mute and also off of mute. And there is a bit of a delay, so we're aware of that. So we'll make sure that we give you some time if we ask a question. If you want to use the chat function, which we do encourage, make sure if you look down in the box that you have there on your screen, currently it might say host, toggle down in the drop-down list to all participants. If you want to ask just a question of presenter or the host, then just send to host like it says there. That's fine. And then type your message in the box and hit send. All right. Our agenda today, we have quite a bit of stuff in it, so we're going to move fairly quickly. And our goal is to introduce you to each item in the test box. You should have received the actual test box document in your mailbox last night. And everything is outlined in there, but we want to just go over it with you today. So we'll talk about writing a name statement all the way up to shifting the conversation. So all of those items, and then we'll have a quick wrap up at the end. And we do want this to be interactive, not necessarily just us talking to you. So if you have questions, if something isn't clear, or you have some ideas, we really do want to hear from you. So this isn't like a formal presentation. It's sort of a chance for all of us to meet before you go and meet with your teams. So just so we can share with each other who is here, if you recall from last time, in the chat box, if you can type your name and where you're calling from this morning in the chat box, we will get a chance to see who all is on the call. Just give you a moment to do that now. I see the names coming in. All across the province. That's great. Can you all see the names of each other as well?
Yeah.
Yeah, we can.
Excellent. Great. All right. It looks like it's slowed down now. So welcome, everyone. And again, we do want to hear from you, so so either use the chat box or feel free to come off mute and talk. All right, so as I mentioned, we're going to touch on each of the items in the test box. And for test box 1, we have six items for your teams to choose from. Again, because these are somewhat foundational, we're hoping that the teams will address each of them. But there may be some that they've already done, and if they have, fantastic. We still want to learn from them what lessons that they gleaned when they actually started doing these things, and over time what they've learned. So if you can, it's important to at least go over each item with the team, and then again, it's still up to them to decide which ones they want to test. But do encourage them, if you can, to consider testing all of them. So I mentioned that you have received an email that had the document. So you have 2 documents for each test box that you can expect coming forward in the year to come. The one document you see on the left of the screen is the actual test box. And so each of those items that was on the screen before has at least one page on it. And we tried to kind of keep it to a front-back page. And then there might be some tools or extra information, that that accompanies that one-page item. So it depends how you're set up with each of your clinics. If you have access to Wi-Fi at the clinic and you want to bring a laptop, you can bring that and show the team on the screen. There are some links embedded in the document, so that might work well if that's how you're going to approach it. They may want to have a printout of some or all of it, and that's also fine. We did design it so that it is printable, easily printable for you. If you're in a clinic and it's just easier to print it and bring the pages, that's also very doable. The document on the right is the guide for coaches, and so that document was prepared just for you, and it just kind of also goes over each of the 6 items in the test box, but gives you some little tips, some facilitation tips, how you might want to introduce it to the teams, what you might expect, some things to watch out for, that sort of thing. So it's just sort of some little behind-the-scenes stuff for you. So those are the 2 documents that you can expect to receive each time. Are you seeing a blank screen? Oh, there we go. It's just a little slow. All right. So the first item in the test box is not really so much something that you need to test. It's more of just an encouragement to ask your team to write an aim statement. And sometimes teams get excited and they just want to get going and start making some changes. But what can happen if we don't have our formal structure, our QI structure behind the changes? Sometimes we can get lost or unfocused, or not everyone's on the same page. So you recall the model for improvement. An aim statement really kind of clarifies that first question in the model for improvement. What are we trying to accomplish? Teams often are really excited about doing PDSAs, and they get that, and they kind of want to move right into PDSAs. But if you can encourage them to just pause first and write that aim statement, it will really help keep the team focused and aligned on what they're doing. Now, I've written here a visual reminder. If your team spends the time to write an aim statement, but then they never look at it again, it was kind of a wasted exercise. So again, encourage the team to think about, where are we going to use this aim statement? Where can we put it that we'll see it, and we'll have that visual reminder, so we can always check in and make sure we're still working toward answering this question. So some teams, if you have agendas that you print for your meetings, some teams will have it as a standard header on that agenda, so that every time you have a meeting with the improvement team, you'll see your aim statement at the top of that agenda. Or some will put it up somewhere in the room where you meet. So again, get creative. It's up to you, but do consider working with the team on having it visible. So with an aim statement, they're fairly straightforward, but people will often miss a piece. So if you can ask the three questions, so what do you aim to change, by how much, and by when? If your aim statement answers those three questions, then you know you've got a good one. You've got a solid aim statement. So the example we've given here is we will increase the number of annual care plans completed for patients 75 years and older without a visit in the last year or past year from 41% to 84% by October 31st, 2018. So some key components of this statement, you can see there's always a verb in there, and it's usually something like increase, decrease, improve, something like that. There's always that action word in the statement. It's specific who they're targeting in these PaCT aim statements, the patient population. And then there's usually a percentage. The by how much is often a percentage. And you can either just say the overall percentage that you want to improve. So in this case, we could have said without a visit in the past year by math skills, I think 43% by October 31st. But it's often interesting to include what your baseline measure was in the aim statement. So in this one, we've said from 41%, which was their baseline measurement, and then their goal is to get it up to 84%. And again, consider things like stretching. The team could have said, well, reasonably, we could probably get it up to 60%. But encourage the team to think about stretching, because sometimes it might actually be relatively easy to get to 60%, and then sometimes, we're human and we're like, well, made it to 60, we're done, and then we just kind of back off, when really they maybe could have gone a lot further. So encourage them to reach a little bit, set that goal a little higher than maybe they think is easily attainable. So we'd like you to either chat in or come off mute and speak, but has your team set an aim statement yet? And if so, how did it go? And do they have any plans for how they're going to use it? Or are they displaying it somewhere? So chat in and let us know. Or if you haven't chat in, no, we haven't yet. And it would be good if someone wanted to come off mute as well. And Sharon says they have not yet. Thanks, Sharon. Monica, have it on the agenda. Awesome. Great. Well, thanks for sharing that. And again, I'm going to assume that maybe others aren't quite there yet. So again, in your planning with your team when you're meeting, just consider adding this as one of the first things that you do with your teams on your agenda. I'm going to keep us moving because we have a full agenda. Oh, thanks, Darty. Awesome. Got one, but it's not visible yet. Great. Okay. So again, in your resources, in your guide, there's some information, and then this also shows what the team will see, which they will get some information that you can review with them as well. And in the test boxes, each item describes sort of what we're talking about, why we've included it in the test box, why it's important for care planning, and then some tips for the team, and then usually a test or a challenge for what we're asking them to do. All right. And the other thing is, if you yourself are wanting more information on the model for improvement or aim statements or running PDSAs, an excellent resource is the website ihi.org. Really excellent information there if you wanted to learn more. Okay. I think for this one we'll move past the discussion, because I think we've got some more rich topics coming up here that you may have more to talk about. So I'm going to ask Lisa and Jessica to pass the baton to Barbara, who's going to talk to you a bit about standardized data entry, the EMR for team-based care.
Thanks, Michelle. And this is an important topic to have early on, and I think it was appropriate to include it in test box 1. While it's something that will be ongoing, having early discussions of this with your teams can prevent a situation where later on you'd be going, oh, I wish we started that earlier. So why should you be thinking about standardized data entry right now in the EMRs that are being used for care planning? So first of all, it'll enable the team to know where to find information. And early on in your improvement cycle, you may find team members saying, whoa, geez, I put that there and you put it there. Let's start putting it in the same place. Another important consideration is that once you have information standardized where it goes in a searchable place, it enables population-wide care reminders. So even though you will be caring for patients individually, those population-wide reminders, example rules in WOLF or a goal or CDS trigger in that access, for example, allows team members caring for a patient to catch those things that have periodic repeats for care to make sure that they don't get dropped. Importantly, later on, as you are using the care planning template, if something's in a standardized place that is also mappable, it can map from the chart into the care planning template. So that will prevent duplicate data entry by team members. It'll make the care planning process with the patient smoother because you don't need to take time to reduplicate entry. And importantly, it'll allow the team to measure things. So if you have something in a searchable place where you know it is, you'll be able to do some measurements throughout the PaCT initiative. Importantly, at this time, you should talk with your teams where data entry is not yet standardized. And here are a couple questions that you can use that you could use with your teams. So consider the population that you have identified for PaCT. Where are you entering information so that you can take your measurements associated with that? I'll also give you another example, is that you should be at this point saying, how are we marking in the chart that a patient is a complex health needs rising risk not managed? What is your standardized data entry for that? And actually at this point in the chat, I'm going to ask you if you have done just that. Have you and your teams found a way to chart which patients are complex health needs rising risk not managed? And if you've already done that, put it in the chat. It would be good to see who's doing that and actually what you're calling it. I know we put a suggestion in that you could call them complex health needs, but you may have chosen another term with the teams that you're working with. So if you've already done that, just put that in the chat right now. And also think, and this is different for every EMR, which information you do want to map to the care planning template. And there isn't a one-size-fits-all, so you have to look at exactly how each EMR works. But have you standardized those data elements that you will be charting that you would like to map to the care plan template? And thinking about the quality of that data that's mapped so that when it transfers from the record to the care plan template, it's a logical transfer in terms of the information and quality of information. Okay. So just some tips at this point. The general EMR user guide's on the website, and then you have to click down to get the specific ones, as well as the videos that are on the website. And I know for most of the EMRs, we have a video on there specifically using, for example, the problem list in WOLF to call a patient a complex health needs patient. So, and actually, I'm not seeing in the chat that anybody has gotten to that point yet of creating a name for those patients with complex health needs rising risk not managed with each team. So that's good to know.
Kathy posted.
Okay. Why can't I see that? Anyway, Michelle, that's all I have this morning, so I think I'm going to keep you on time. Oh, yes, and some teams are posting in the chat. I see it now.
Oh, excellent. Yeah, I see that. Thanks, Dr. Joseph. Your team has done that. Awesome.
Could I just ask, if they post to all participants versus all attendees, does it go to a different group?
Oh,
because Kathy posted to all attendees, and I can see it, and Dr. Joseph posted to all participants.
Okay. Jessica
So,
and Lisa?
yes, it does make a difference, and so we would just recommend that everybody post to all participants, because you've got your group of panelists that are your presenters today, and they may not actually be able to see your comments if they go to, to all participants. So
All participants.
You should have.
Yeah, I'm not a panelist, so I can see both, but I'm thinking maybe those of you who are panelists can't see the one.
Yeah, you're right, Marion, because I can't. It's Michelle, and I can't see Kathy's comment. So, all right, thanks for clarifying that. And we've decided today that Jessica and Lisa together are Jayla. I think we decided. So thank you, Jayla, for the technical help we need today. All right, any other chats or comments about the EMR work that Barbara just reviewed? Does that all make sense? As we know, the EMR is a critical.
Yeah, and I'm just going to comment on what Kathy said about MedAccess. Yeah, because in MedAccess, you're going to do it in the profile, same as in Accuro. And I know in my example, I said the problem list. That makes sense in Wolf and HealthQuest. But in MedAccess and Accuro, you use the profile to do it. It really makes a lot of sense. And I like what Kathy also posted, and they use the status in that to show if it's active or the patient declined. So that's a great tip for other MedAccess users.
I'll just give a moment. Does anyone else would like to post, or if that's a challenge for you, please again just feel free to come off mute. And this is just this is our meeting for you to get prepared. So please speak up if you have a question or something that you'd like to share with the group that might make their experience easier. All right. Okay, Julie, I think I waited for 8. I was counting. All right, let's move along then. So next up, we have using the current state process map. So we know that that's one of the first things we asked in the starter box for teams to consider mapping out their current process. And so I'm going to ask to have the control passed to Sue for this part. Jayla, if you would pass the baton to Sue, and she will review with you what's in the test box around using the current state process map.
Perfect. Thanks, Michelle. So again, just to review how valuable a process map can be, it really helps to develop a shared understanding of a process among the team members, and it really helps to identify areas for improvement, identifying bottlenecks, repetition, and we'll actually be referring back to this current state map throughout the year together and bringing it back to the team. So it's a tool that we want you as coaches to be using with your teams as care planning evolves over the time. Just a couple of other things that a current state or a process map can be really helpful with is to clarify roles and responsibilities, pinpoint areas where measurement would be helpful, and really to help onboard new members of a team. And all of this information is on page 4 in your test box 1 guide. Now, I know that many of you have already done this with your team, and I'm having trouble advancing. Let's see here.
The little arrow at the top of the screen. It's a little tiny on the, there we go.
Oh, yes, I actually just didn't quite hit the actual arrow. We know that many of you have gone through this process mapping exercise with your teams, but some of you may haven't quite got to that point. And so what are some of the things that you can do to help a team that you're struggling to get together all in one room to do process mapping? There's a few different approaches that you can take. You can do observations, so actually tracking team members going through the process of their current way they're doing it and making notes with that. The other way you could do it is kind of a guided interview. So you could interview those team members that are part of the care planning process currently to help form a process map. And then during a meeting, you can bring back that information from those observations and from those interviews and kind of present a process map based on your learning to then check back with the team to say, did I get this right? Or are there other ways that this is being done? Does this make sense? And it's just checking in with the team to make sure that that you have captured it accurately. So those are just a couple of different ways that you can go about process mapping without being able to get everyone together to go through that process. So once a team has agreed that the current state map has been accurately captured, it can be used to look for areas to improve. So as a team is testing, adapting, and adopting changes, you can capture the new overall process by updating the map. So some of the things we want you to be thinking about with your teams are where are there opportunities to improve the care planning process? Are there steps in the process that aren't really patient-centered and are, opportunities for improvement? For example, are patients waiting through the process? Are we not setting the right expectations? Are we looking at sending patients back for labs that maybe could have done beforehand? And also to think about with your teams, is there an opportunity to get a patient involved in designing or reviewing the process? Now, when you're going through these changes, we would love for you, because again, this is a learning process for us as well as for your teams as innovation hubs. We would love that as this process map changes over time, that you're actually capturing those changes in different versions. So think about how you might want to document that this is our current map as of today, and then as it changes, versioning it or date stamping it so that you can look back over a year to see where you started from and how your process has evolved over time. That would be really, really helpful for us and for your team as well to see how far you've come. So this is an example of a current state map, and we actually produce this in PowerPoint, and it is now posted to the PaCT website, and I'll show you where that is in just a moment. And so this is something that if you haven't got it in a form that's easy to modify, we thought giving you this in this text box would be really, really helpful. And you can basically just go in and modify this. So some things that when you're looking for opportunities. So for example, is there an opportunity to proactively identify and schedule patients? Is there an opportunity to better prepare patients for care planning conversations? This current state map could be annotated to show what some of your opportunities may be, and it would help guide some of your PDSA cycles as you're going through, okay, this week we're going to see if we can tackle who else could be doing the blood pressure checks other than the physician. This would just help guide. So again, this is available on our website in the PowerPoint version. So just would love for you to chat in. First of all, have you and your clinic teams created the process map? And I know many of you have. And also some key learnings. And what did your process maps reveal?
Charlotte has typed in there soon.
Oh, okay. So Charlotte has mentioned we've set up a map in Vermilion and completed the first 2 patients. And then we had a meeting on Monday where we looked at how the flow went and made changes. That's awesome. Fantastic. Anyone else like to chat in what their process maps revealed? Oh, a question from Edmonton Southside was, what kind of software are people using for process mapping? There are a number of different softwares available. There's Visio. You can do process mapping in PowerPoint. It's probably the simplest. What are some other ones that are being used? Visio, I see. Monica has mentioned that we have completed our flow map and we'll be reviewing it next meeting to ask those questions. Perfect. Great.
And just a word to the wise, if you were to try and do process map in Microsoft Word, it's doable, but it's really challenging. So if you have Microsoft, I would definitely recommend using PowerPoint versus Word.
All right. So here, as promised, are the resources. It's under PaCT, Tools and Resources. And if you go down to the bottom here, under the Innovation Hub Test Box 1, there is this sample process map. And there's also a really great processing map guide that was put together in collaboration with AHS and AMA around the steps for process mapping, and it talks about the overall steps to keep in mind, the analysis and how you can, reflecting on questions. And then as an optional activity, many teams will do a current state map, and then they'll think outside the box about what we might want to look as a future state. So where is it that we're trying to shoot for? And then that's kind of the North Star for a team to shoot for, and then all of the changes along the way are trying to get to that. So that's an optional thing as well. So you have two choices. You could think about what your future state map might look like and what you're trying to shoot for, or you can simply look at your current state and identify those areas that you are going to tackle and just go one by one through your PDSA cycles in terms of changing it. So you have a couple of different options and a few resources there to help. Are there any questions about process mapping before we move on?
Great. So now Julie Robison is going to talk a bit about setting the scene for care planning, and Sue's going to kind of pipe in on a few things too. So Sue, if you just want to continue driving the slides, Julie can let you know when to change.
Sure, I'm happy to do that.
Sure. Well, good morning, everyone. So we're going to talk a little bit now about setting that strong foundation for the patient-centered interactions. So what you can see here is an activity guide that was created to really help support you with your teams to think through what are the things that might assist you to really build some rapport and trust with the patients and the environment. So you'll see that there's a number of different things from health change that are being brought forward that can help guide you in that, or have you test a few things. Some of these things may be things you've already done, and so we'll be really excited to hear what that looks like for you and your team, but also maybe some areas that you might want to try out. So the activity guide will be something that we'll continue to reference back to, not just probably in this test box, but in future test boxes as well. These things can support your team to ensure we're working in a way that's building that trust and rapport with our patients and creating a place where they can engage with us in care planning and build that environment for them. So we can go to the next one, Sue. So in this test box, we'll really be focusing on looking at what the physical environment looks like. And in health change, we call that set the scene. And what that really looks at is determining what's going on when a patient comes into our clinic. How would they actually experience the environment, whether that's right in the waiting room and into where they're having their care planning appointment with you. So we'll be focusing on that, but also looking at what's happening to actually prepare them to have these care planning appointments. So how do we actually support them to be engaged and make it more likely that they want to attend these care planning appointments and work with us through the care planning experience? So if your patients have been in the clinic for more than a year, we really want to ensure that we're thinking about what type of messaging do we need to be offering to them, so we'll encourage them to engage and work with us in this process. We'll go to the next page. So what you can see here, and if you look in your guide on page 7, this brings forward some questions that can help you to bring to the team and consider what are some things that you might want to look at together to see what the physical space is actually looking like for care planning. So, questions around, when they come into the clinic, what do they experience? Things like, are the chairs suitable and appropriate, for all body types, for all patients that are coming in? Are the environment that which we're working, would it make them comfortable? Are there things maybe on our walls or things in the space that might create, some place where they're uncomfortable or they're feeling that they may not be a part of a collaborative team? So really taking an objective look at that together and exploring, what does that look like for us in our clinic and in our space? There's a couple other points that you'll see that are on there that, really relate to components of the methodology, as well as encouraging patients to really be involved in how they're interacting with us. So in order to enable them or engage them in the process, can we encourage them to write some notes? So bring some paper. Are we doing that? Do we have the space set up so they could write some notes if that's something that they would like to do, so that they are engaged and able to take the information back with them after the appointment? So these are some things that you can work together with your team to ask to see where you currently are. There may be some of these things happening, and there might be opportunity to explore other components. I'm interested just in the chat box to hear from each of you on the teams around things that you might think will come up for your team as you present this to them. If you have some ideas around what are some things in the physical space that might be areas that you and your team will want to explore.
And Julie, Kathy Stark has sent in a message while you were chatting there, mentioning about the last point that they had a patient ask if his wife could attend because he thought it should be approached as a family experience. That's cool.
Yeah, great point, Kathy. And I think that that's another key component is how do we ensure that it's not just the patient, but we're really including families in that interaction, because many times they are the ones that are going to prompt them to do things after the appointment or to be the support in that. So how do we make sure we're thinking of that and we're working in a way that engages the entire family? Good comment for sure. So any other thoughts around, as you may bring this to your team, what might be some of the things that would come up about the physical environment for care planning?
I'm just looking at the time, Julie. Maybe.
Yeah. Well, definitely. Let's move on. We'll be really interested to hear back from you guys in the sharing. So these were just some possible examples of things that may come up. But some of these I shared in my previous discussion there, is looking at things like chairs, understanding that there's a space for them to actually engage with us if we're working in the EMR, so they can actually see that and understand what it is that we're writing, as well as looking at where we're putting some of our maybe measurement tools, such as a scale, so that there's some privacy in how we're doing some of those assessment pieces. So just some examples that can be brought in. And I see that Charlotte's just writing in the chat box about the physical layout of the office, and I think that that's a really great point, Charlotte, and kind of speaks to that last piece I'm talking about where we complete our assessments or where we actually sit down and have those conversations about care planning, depending on the layout of the clinic, can really engage our patients, or we can actually create some barriers to that engagement. So, great example. We'll move on just to the next activity. And this is really focusing on ensuring that across our whole team that we really understand what is it that we're accomplishing with care planning, and how would we actually provide consistent messaging that reflects what the care planning process is all about. So this allows opportunity for teams to come together to really ensure that we're looking at what are the key messages about care planning, and are we together as a team about what that looks like? How will we actually involve the patients in that process, and really be thinking about, who needs to know this? Would all members of our team actually be able to articulate what care planning is and what that looks like for our team in our clinic? Sue, would you want to add anything there in regards to this activity?
Yes, I just wanted to add one of the next test box items is around scripting, and we'll definitely get to there. But it's really thinking about all of those people that may interact with the patient and may get asked questions about care planning. And so being very strategic in your thinking about the clinic, about who might get asked a question about care planning, and making sure that they are very well prepared to answer those questions. So it could be anyone that is patient facing. Anyone who interacts with patients may get questions about that, and you just want them to be prepared.
So any questions from anyone on the call about what that might look like, about how you may bring those activities to your team? Just up on the screen shows you where you can find that resource that we were referring to. So in the same place as the process mapping guide as well. Okay, well, let's move on then and looking at the next component around scripting for care planning. And Sue and I are going to share about how the scripting can actually support the development. And it sounds like some of this work is already happening. I know when I came on the call, there was some sharing about some of this already occurring, so it's great to hear. And we'll want to hear more from the teams. But what you're going to see up on the screen is an option where, as teams, you can actually work together to actually do a bit of a role play to see how things sound and feel, so that we can actually see what we might want to change. And so you'll see on the screen right now is option A, which might be a way that potentially, some conversations may be going. So looking at, good morning, Mrs. Brown, this is Blue Meadows Clinic, and you're overdue for your complex care plan visit. We have an appointment for you on December 19th at 2 o'clock. So that's one way right now that potentially, booking a care planning appointment may sound. And what we want to offer is looking at opportunities to say, are there different ways to adjust that, so that we're really thinking from a patient-centered lens around what can actually support them to be more likely to come into that appointment and to actually engage with us and be involved in that process. So if we click through, we can look at another option of how this may sound, and would encourage you guys as teams to practice this together and see how that feels. So you can see the difference in this conversation is first checking in. Am I actually speaking with Mrs. Brown? So that we know we have the right person, but then also ensuring that we have an opportunity to share what the role is of the person on the call. So if it is the MOA that's sharing it, really just letting that patient know what their role is, so that they feel more comfortable and more likely to want to engage in that conversation. So you can see how that changed, as well as checking in. Is now a really good time for you to talk? Because one of the things I'm sure for those on the call that you've experienced, even for yourself, is that, if we're calling to book something and someone's in the middle of, cooking their meal and their pot's boiling over the stove and they're distracted, that it might not be the best time to actually get them to commit to that appointment. And so we want to check in on that and really make sure that it's a good time so that you can have the conversation and engage them to be a part of that process.
And Julie, I just wanted to add, so one way that you could do this with your teams is actually doing the role playing and asking after each of these examples to say what was positive about that call, what might be some potential drawbacks on that call, what might make it better. And in your test box, we have included 2 scripts. The first one is quite short because it's not very patient-centered, and then there's a second script that you can go through. And it might be helpful if you are asking someone to role play that script, that they have looked at it previously, and it might help if you are playing the patient in that role play, so that you could guide some of the answers. So those are just a couple of tips. Now, when just talking about the more patient-centered script, we worked on that collaboratively and had our team members from Health Change Methodology really look at that script from the perspective of health change methodology. And so it's an example, but we want you guys to go and test it and make it better, because it's not perfect. There's probably some things that can be improved in there, and we're looking to you for that, for testing that. Also, in your package, and things that you might want to consider to review with your teams are elements of scripting. So we have some information in there, things to keep in mind for in-person scripts, and also things to keep in mind for telephone scripts. And really, because you want the scripts to, some teams are object to using scripts because it feels like it's unnatural, and so we really want this to be a conversation. And so if teams practice and role play with each other, then they get much better, and it does become part of the conversation. Also, just wanted to mention that patient representative, when you're doing scripting, is hugely helpful, and definitely can provide some really good input into the process. Julie, maybe I'll hand it back to you.
Yeah, sorry, my mute was not coming off. So here you can see in the activity sheet again that can just guide you. And I think just to reinforce what Sue was saying, I think it is really important that when we're using scripting that we find the way to make it natural. And so there are pieces within these activities that can help you to do that, and really encourage you to take time as a team to practice and get into a place to see how it feels, especially from a patient perspective, if that was the messaging that you were receiving on a phone call, and how that that experience may be for you. So encourage you to look at these pieces and see how that feels and share back with us. So what you can see here is just what Sue was alluding to is around the sample scripts. The first version, of course, looking at a shorter, maybe not as patient-centered version, and then a little bit more in-depth version that has elements of health change that really help us to create some trust and rapport with our patients and build that space for them to engage and come into those care planning appointments. So you can see if Sue moves on, those will be on the website and available for you guys to utilize. Any questions about that component around how we can really be using that scripting to support the patients and their patient-centered interaction? Okay. I'll hand it back to Michelle then.
All right. Thanks, Julie and Sue. So I just wanted to talk quickly about the last item in our test box number 1, and that is just asking the teams to think about shifting the conversation. So we know that one of the really at the heart of PaCT is shifting the conversation to really focusing on what matters to the patient. And we know that when the patient, when the care team understands what motivates the patient, it's much easier to kind of tailor or help the patient connect with how working on their health will actually help them reach their own goals around what matters to them. And so it's really critical that the team knows up front, early on in the process, what really matters to this person. And no one could guess, right? It's so individual. So as a team, this item of the test box is really just asking some questions, getting some thought around how do we ask during our care planning appointments? When in the process do we ask? Do we ask early enough to really be able to keep that in mind as we're going through the process? How do we ask the patient? And are there some creative ways you could do that? It could just be a simple question, or there could be some other ways that you approach it. How do we document that answer? Perhaps, this is good information to know into the future, not just in this one appointment. So how and where are you documenting what matters to the patient, what motivates them, what's important to them? And then how are we consciously and purposefully incorporating that information into our interactions with the patient? So these are some questions, again, to ask of the team to get them thinking about their processes. And I know that when we heard in the Share and Learn last time, Riverside Medical, they talked about that they've already started a bit of this. They have what they call their What Matters to You list at the front desk. And Kathy was telling us about in their PDSAs, they encountered some challenges because they found that the patients weren't quite understanding what they were being asked, and so they were just using it as an opportunity to complement the clinic. So they're working on that in helping patients to understand that they're actually asking what's important to them in their lives. And so Kathy, we're excited to hear updates from your team on how that's going and what you found has helped to help patients make that connection to what you're actually asking them. So we really, again, encourage your teams to get creative. How else, other than just asking, could they determine what matters to the patient? Any comments or thoughts on that? Have any other teams started to work on that? And we are also working on some things behind the scenes too that we may ask some teams to test out and modify and make your own. So stay tuned for that. We've got some ideas for some little cards that patients can kind of sort and identify what sorts of things are important to them in their lives. So. And we will, as the year goes on, we will test out some different things, and we again look forward to hearing what your teams come up with as they get creative around these things. All right. So the next steps. And thank you, Charlotte. And the next steps. Charlotte's wondering if we're going to move the Share and Learn back a week. We discussed that, and we think we had actually added extra time in the interval between this coach's session and the Share and Learn because of the whole holiday season. So we felt like we probably will be okay, but we will look for feedback from you. If you feel like your team just needs more time and the holiday season in particular is really impairing your ability to meet and get things going, let us know, and we will look at adjusting the times. It sort of shifts the whole year, so we were hoping that we can make this work if possible. But if not, let us know, and we will absolutely make those adjustments. Here we go. So upcoming dates. Currently, we have the Share and Learn for Test Box 1 set for January 25th. And then Test Box 2 would be introduced to you in another coach's prep session just like this on February 1st if our timing continues as is. One other thing I'd like to know, if you wouldn't mind putting in the chat box, the timing of the coach's prep session. We chose 8 till 9 in the morning because we know that lunchtime is sort of the time you meet with teams. So we thought we didn't want to interfere with that. But we also want to know from you, does this time work, or is there another time of day that would be better for you? So if you could all just pop into the chat box, what is the best time of day for you? We will try to adjust to meet the maximum, see if we can make it work for the most number of people. That's great. I see a few people chatting in. So if you could just continue to do that, that would be awesome. And then just some reminders. So when it comes to the Share and Learn, these are the chat questions that we mentioned to the teams in the last Share and Learn, the things that we're going to want to know. So as you go through Test Box 1 with them, and they select the items, hopefully all of them, and test them and incorporate them into the clinic, ask them to remember these are the things we want to know. What did you test? What did you learn during that testing? So are the things that you tested, are you like, yeah, they were awesome, we're just going to adopt them, they worked awesomely, or it was okay, but we had to make some changes. These are the changes that we made, and now we think it's getting better, and we're still going to work on it for a bit. Or that just really didn't work for us. We don't see any way that it could fit in our clinic world, so we abandoned it. And then also, what would you recommend for other teams? So, of course, we're planning PaCT for the province and putting together what will ultimately be the package that goes out to all Alberta clinic teams. So do they have any recommendations that would make it easier for other teams to adopt? And as the coaches, we also want you to keep in mind we'd like to have maybe just one team. Again, we apologize to the teams last time. In our learning, we got overzealous and asked 2 teams to share, and that was probably too much. So we apologize for having to rush you and cut you short. So next time we'll make sure we just have one team share. But please keep in mind, if you see your team doing something that you think other teams could benefit from learning about and hearing, please let your IA know, your improvement advisor at top know, and we'll try to schedule them. We want to hear from each team at least once over the course of the year, so keep that in mind. All right, thank you all for your feedback in the chat box. And just a reminder that we will try to post the materials. For instance, this webinar has been recorded. Once we have it all merged with the audio, we'll post it on the website for you so that if you want to come back and listen to it, or if there's someone who wasn't able to attend, you can guide them to the website to view it. And again, we'll also post all the materials. We'll email them to you when appropriate, but if you need to come back, you'll always be able to find them on the PaCT website under Tools and Resources. And that brings us to 9 o'clock. So thank you, everyone, for attending the first coaches prep session. And again, if you have questions, you always have your improvement advisor that you can go back to, who can connect you to the right person, or they can help you if you have challenges or questions. And otherwise, we wish everyone a happy holiday season, and we will talk to you next at the Share and Learn.